Hey everybody, we've got Nate Graven with us from Graven Sports Therapy, and today we're going to learn a little bit about some things that you can do to help keep yourself a little more healthy. Nate, why don't you tell us what we're going to do?
We're going to concentrate on some calf work, which would be some of the just maintenance massage, some of the myofascial work we do here. It's all about getting functional movement and some improved alignment down through the muscles of the calf. And then just as we come across points of adhesion or irritation, we try to correct those as we go, make things feel a little looser, a little lighter, a little more natural range of motion.
All right.
So this is this would be a common calf treatment we do with our runners.
Great, thanks.
So it's always, I like to start on the front of the leg. We just want to get functional movement down this anterior compartment, kind of start getting the posterior compartment off. So many times we'll get classic shin splints, and it's just compression all along that tibia. So we just want to get some movement in that connective tissue. So we're just cross fibering. So this is just, it's a midline stroke. We're from the midline separating the tissue. So just deep intention. We are trying to put a stretch in the connective tissue so that the muscle itself has a little less restriction. It can open up some of the circulatory pathways, change some of the pressure on the sensory nerve endings, so help with pain, help with circulatory benefit. And then we'll start sculpting. This is run along that, just that whole anterior group, tibialis anterior, and some of your toe extenders. You'll always do good self-stretching, but sometimes when you're doing a stretch, whatever the shortest point of the muscle is what's going to be the first binding, and that's not always going to be what needs extra attention. You'll develop knots and trigger points all along muscle bellies and have adhesions at different areas. So by adding, some good deep massage work along the whole path of the muscle, you get more functional separation and just improved tissue health. Whereas, a good deep stretch is still helping, but you're only going to get effective lengthening at the shortest point of the stretch. This is getting the actual extensor tendons. We're just lengthening, putting a stretch on those, but then I'm mobilizing between those partial joints.
Okay, go for it.
So we've done the midlining work, we've done some sculpting work through the tibia anterior, we've lengthened as they go down into the foot area, got separation off this tibia, and that little bit of work already has unloaded the anterior shin line. The ankle is sitting unloaded, there's more movement across that, this tension on that muscle belly is changed, whereas this side, that is still tight through up into the ankle. The compartment itself has a little more twist, just the feel of the tissue is more fibrous and restrictive still. So that's a therapeutic outcome already. Just getting compartment separation on the tibia anterior, some movement off the tibia itself, and unloading at the anterior ankle space. So that's a start for change on that little bit of midlining.
Great.
Calf. So we've unloaded through that front. Now, we're going to try do the same work. I'm going to midline the calf in general, and then we're going to lift it up and get separation off the superficial posterior group, that gastroc soleus, get in on the toe flexors, tib post, and then some of the peroneal group. Peroneals for the runners, a lot of times anybody that's had ankle sprains or strains or just a lot of even IT band stuff can still create this whole lateral strain down the peroneals. So there's a midlining again. Enough pressure to break up the adhesion and get some movement, but not so much that you cause guarding. I mean, if you go so deep so fast that you cause the muscle to spasm, it's kind of counterproductive. You're not stretching fascia at that point, you're fighting nerve tension. So, and these are tied in here. Alright, and I like to bend at the knee. That unloads the calf a little more. As soon as you bend the knee, it shakes some of the tension off the superficial group so I can get in deeper. So now this is specifically on the peroneals. This will take pressure off the fibular head. Sometimes people will have just pressure up into the outside of the knee, and that can be strain from down here in the lateral calf contributing. across points that just feel a little more fibrous and just active trigger points that are causing a little more of a zing, and so I give extra attention on those. And sometimes adding the movement. So there's a pin and stretch. I'm pinning down where I have a restriction and then stretching at the ankle, so that creates direct length through that group. Over the lateral compartment, now I'm going to try to get the tib post. A lot of times people, they get classic, midline shin splints. That's the tibialis posterior is going to be the one. After we've unloaded the calf in general, I can get right behind, and I can actually sculpt all along that tibia. And this affects the toe flexors and the tibialis posterior muscle. And that tibialis posterior creates the medial arch, so you can even have plantar fasciitis type problems, arch pain, and that will be this muscle being tight. So that's me working very deep behind the tibia line after I've gotten the compartment to allow me to get in there. Same thing there, sometimes you can get right on a structure, do a pin and stretch. And that'll unload that part of the calf. So same thing there, now that we've unloaded the calf, there's less tension throughout. The shin line's down, the ankle is unloaded. You can see that shin is just down onto the table. This side's raised up, turned out. So it's just a separation. Look at the way the ankle sits straight. There's less pressure coming down. So that's an aligned muscle group that's set in the position of the ankle. Whereas this side, there's a little bit of a twist. The ankle itself is sitting on a twist. The Achilles has a little more twist, and it's just elevated. It's just engaged more. So that's a change in that little bit of work to unload the calf, get organized movement between the muscles so you have less joint pressure and pain, improved alignment, which will help for mechanical action, and hopefully prevent the next injury.